All right, a couple minutes after the hour, so we're going to get started. Hi, everybody. I'm Ceci Nyman. I am the Deputy Director here at the Center for Early Learning Funding Equity, and we are thrilled to be here on this lovely Wednesday. I'm sitting in the city of Chicago, but we're going to take you around the map a little bit today and share with you some kind of the third in our four-part webinar series on mixed delivery and really the financing of early care and education. We're thrilled to have two guests from the state of Louisiana today. I'm going to let them introduce themselves. Libby, you want to kick us off?
Sure. I am Libby Saunier. I am the CEO of the Louisiana Policy Institute for Children, which is a nonprofit, nonpartisan organization squarely focused on children birth through age 4. We often say that once you hit 5, you're geriatric to us. And so we are a very narrow and deep organization, really focused on being a go-to resource of research, policy, and data for young children in the state of Louisiana.
And Jen?
And I'm Jen Roberts. I'm the CEO of Agenda for Children. We're a 40-year-old nonprofit organization that is headquartered in New Orleans, but really works regionally across Southeast Louisiana. In addition to being the child care resource and referral agency for 11 parishes, we also do professional development with teachers, data research work, grant making, as well as enter into public-private partnerships with some of our government entities, which we'll talk about today.
Exciting. And we have a lot to cover, so we're going to jump in, and this is a conversation. So I'm going to cue us up a little bit in terms of setting up the conversation, and then really going to ask Libby and Jen some conversation or some questions that's going to lead us through a conversation. And our goal is to leave some time at the end for you to ask questions. You can as well put questions into the chat as the conversation goes on. Tom Lehman is with us, our senior policy fellow, and he is monitoring the chat. So please do put your questions in there and we'll try to get to those. We will share some resources as part of this webinar. We'll put them in at the end in the chat. And then there will be a follow-up email for everybody who registered for today's webinar with the slide deck and the resources. And so don't fret, don't try and take notes. And it is also recorded. So that will live on our website, as do the previous 2 webinars that we've already hosted. Those recordings and decks are also up on the website. So today, as I mentioned, is the third in our 4-part series on really building coherent funding strategies with children and families at the center. We adapted this picture that was made by one of our colleagues and dear friends here in Illinois many, many years ago, as she was a known scribbler and doodler. We've dressed it up a little bit, and really what this kind of demonstrates to us and reminds us all the time is that when we talk about serving young children, we talk about all children and we talk about all settings, honoring and trying to meet the needs and the preferences of families with children birth to 5. Today's webinar, we're really going to dig into the coordination of funding streams with state and local, right? Local could be a city, a region, a county, depending on how your state organizes itself. But it really is that relationship between those two in getting things done for kids and families. So our series is called A Patchwork to Systems, a mixed delivery webinar series. The first one, they kind of go in progression as our mind thinks. So the first one was really about shaping funding streams into a coherent strategy. So there we really set up kind of what is the problem that we're tackling, and why do we think it's a problem? The second one really grounded us in a strategy around data and community feedback. So we had Michigan and we had Illinois really talking about a data system, integrated data to really allow us to look at all funding streams and all kids at the same time. And then we had Michigan, who really has an age-old kind of statewide intermediary structure that allows for that local state coordination and feedback. And this one, again, is really focused on that state and local funding and how that works together in an aligned strategy. So the next one, the final one in the series, is going to be allocation and braiding across funding streams. So it's really kind of looking at when the money hits the road, so to speak. So we're excited to have that, and that will focus on the city of New York and the state of Illinois. And then we'll that'll wrap up the series, but we will be presenting a build, and I'll talk a little bit about that later. So the state and local structure is a framework that kind of evolved organically in the writing of the series. And it really does epitomize how we think about state and local, and the kind of synergy between the two, the reciprocity between the two, and the value that neither one standing alone really does children and families the best service, right? That we have to have that local input, and we have to have the state's guidance and oversight and administration and overarching strategy, and that those two things need to feed off each other and into each other simultaneously, right? So this is a diagram that really builds off something that I think the build initiative created many years ago, and it kind of takes it to a really thinking about that local and trying to dig deeper into that. So we hope this resonates with you. We hope some of your questions reflect on this, and it's really going to kind of guide our thinking and conversation today. So the state and local structure, we were introduced to the state of Louisiana through a colleague and the work that they've been doing. And we were impressed. We were pretty psyched about it. And really finding who has operationalized a real mixed delivery system is, as you all can probably guess, challenging, right? Many places have one or two parts of what we think needs to go into a mixed delivery system. Louisiana comes pretty darn close. They have really been thoughtful in their policy making, both the legislation as well as their administrative policy work, and to really think about children and families at the center as they've designed a funding strategy, knowing that no system has enough money nobody has enough resources. That doesn't mean that improvements can't be made, and I think that they're the perfect example. And so we're going to dig in. I'm going to start with Libby. I'll put her on the hot seat, and she's going to really guide us through. So Libby, you guys work at the state level. Jen is at the local, right, in the city of New Orleans and in the Southeast region. So tell us about the state local structure in Louisiana. And Jen, jump in terms of the role of the city and how that really plays into creating a quote unquote kind of coordinated system.
Thanks, Ceci. I think one of the things that's important to know is do a little bit of history to understand the contextual factors that got us to where we are with this opportunity to have a state and local match fund. And so I think the biggest thing to know is, we started with just 4-year-old programs in the state of Louisiana, one of the first states in the country to really think about how do we serve our most at-risk 4-year-olds, and have done that relatively well. And then one of the very first state in the country to have a school readiness tax credits that really emphasize why quality is so important. Because Jen and I both, I could say this for Jen too, it's like access without quality isn't access. And so as we think about in 2012, when we unified our early childhood system, all within the Department of Education, quality has always been at the heart of really the reform within early childhood education in our state. And so as that reform happened in 2012 and we unified everything into the Department of Education, we looked at what does it look like to measure quality in the state of Louisiana. And that becomes increasingly important as we really create more access. Next slide. And so, if I would be remiss to say, and we both have friends that are providers, when we talk about the unification of our early childhood system in 2012, it was an unfunded mandate, as things most go many times. And so in that unfunded mandate really helped our providers would share with you that it helped them talk to each other and not be so siloed and not really pit against one another. And so as that happened when in 2016, when the Department of Education started to implement the quality rating and improvement scale, really started to listen to providers and became nationally recognized for best practice with research. And so as that quality was happening and we were trying to increase funding, until 2019, we had no state general funds going into our child care assistance program. That's important to know because in 2017 was when the Early Childhood Education Fund came into being. You can go to the next slide here. And this fund at the time of its inception was a 2-to-1 match. So for every $2 that a local brought to the table, if there was money in the fund, they would get, $1 for their two. What was interesting is that there was no money going really into that fund until 2019. And in 2019 is when we saw CBD products. If there was a particular casino in New Orleans, if they made money at a certain amount, part of that revenue would go into the fund, and thus and so forth. The real catalyst with the fund that really helped it to start earning and generating funding was a one-time investment back in 2022 when we had leftover K-12 money. And our governor at the time said, let's keep the dollars in education, and really seeded that our early childhood education fund with $40 million. In the middle of all that, we were also able to garner 25% of sports betting up to $20 million to go into the fund. At the end of the day, we really think that the fund is good government. It allows locals to think about how they want to invest in early childhood education, really not just with access, but the quality pieces being there. It allows state government to put in some dollars, and then we use our federal dollars to the maximum extent that we possibly can. And so as we think about how do we work closely with our local governments, in Louisiana, we have parishes, as you will see here. We don't call them counties. We're very Napoleonic in that way. And so it's really allowed us to have some dynamic conversation with local government and local early childhood community networks like Agenda for Children on how do you tap into these funds. I would be remiss to say not to share that Agenda for Children was the very first group out of New Orleans to tap into the fund and learn the mechanics of how the fund works. And so how the Early Childhood Education Fund is administered is that the local think we're going to get this amount of money. And then it goes to our Board of Elementary and Secondary Education. And then they are the ones that say, we will allocate this if we are directed by the legislature for spending authority, we would direct this amount of money per local investment. The issue that we're having now is that we've had so many locals step up that the fund is being depleted. In fact, a story just came out 10 minutes ago
This
about
morning.
it just came out that the fund will run out of funds in the next fiscal year. So we are all working very closely together to say, legislature, how do we really fund this, because promises were made and we need promises kept. And then in places like New Orleans, and Jen will share more about this is, if you felt the ground shake on April 30th, 2022, it's because we had a collective that helped pass a millage, which is a property tax. We don't say millage in Louisiana. It makes people property tax in Louisiana. It makes people itch, so we call it a property millage. But we passed resoundingly that increased investment in infants and toddlers in the parish of Orleans, which is the first of its kind type of property tax supporting young children. What you see on your screen now is a funding dashboard that we have on our website at the Policy Institute, and you can QR scan this, and we keep this dashboard up to date monthly. We know what's going in, what's coming out. There's been many a time that I have texted Jen, hey, have y'all drawn down your money? We just sent in the request, because we're watching the dollars that closely to make sure that what the spending authority was given by the legislature will be spent, so that we don't get comments back, we gave you the spending authority, you didn't need the money. We do. We have over 100,000 children in the state of Louisiana, birth through age 4, that are at risk, that don't have access to quality early childhood education in our state. And so this fund really has been an interesting, fun, sometimes frustrating dance between local state government. But at the end of the day, children are winning and families are winning because they have access to quality early childhood education.
Awesome. Jen, why don't you tell us from where you sit in New Orleans and in the Orleans parish, kind of how do you connect into this? And from your perspective, talk a little bit more about the administration of the fund, because I find this fascinating.
Absolutely. So pre-2013, Libby mentioned Act 3. How that looks on the ground is you have a bunch of program types that all live on different islands, right? So you have a graphic there that's kind of there as a joke, but the reality is that there is no role for any sort of local governance. There's no role for government. If you have a concern about early childhood, you have to drive to the Capitol and you have to take care of it. There's no coordinated enrollment or centralization. So it means you're having families who are applying to multiple types of programs, even if they require the same documents. And then you also have a voluntary rating system. I'm so glad that Libby talked about that because in that moment, only 2 types of our childcare centers were actually even able to participate, and the system was voluntary. So we're really talking about going from that to, and I'm going to ask you to go to the next slide, Maggie, is that these new things get added called community networks. And Libby's already told you we don't like taxes, so we call them, millages. And we spend a lot of unfunded mandates, not money. Our issue is that we also say we're going to pilot something, and then it's full blown, full scale within a year across the state. And so what happened was in 2013, the state passed something called the Community Network Lead Agency, kind of underneath something called Act 3. And what that meant was it designated one organization in every single parish that was participating at the time to be their arms, their ears, their hands in each of these parishes. So the requirements were you have to have a coordinating body. So basically build the equivalent of a school district. You have to include every single publicly funded program. So they don't designate locally funded, state, federally funded. Any single person that any single program that receives public money has to come underneath. And the goal then is to say all of those centers or settings, including schools and Head Start centers or programs and childcare centers, have to comply with the same kind of baseline rules. And they say, we're going to create these networks and we're going to select one person or one organization to administer. And what makes this unique about New Orleans is that in 63 other parishes, it's usually the school district because the school district administers Head Start or because the school district is the most logical place for them. In Orleans, if you put this in context, we're at 2013, right? So we're about 8 years post Hurricane Katrina, and we're also 100% charter schools at this moment. So we don't have like a formal role in the same way that other communities do for for a school district. So they ask us as the Child Care Resource and Referral Agency to kind of step up and take on those responsibilities. And those responsibilities in that time were coordinate observations. So you have to do class observations twice a year. You have to have a common application for all your publicly funded programs. If you're gonna expand access, we're gonna be one application from the community, which means everybody who wants seats has to go through a single application that we present one time a year to the state. And it just means overall, we have to count the number of kids. We have to do all the fiscal management or stipend payments or seat payments. And so you start to build this capacity locally for this kind of dual role of being both in community and functioning kind of as a quasi-governmental agency. And then it sets up this new kind of model because when we decided to take on these roles and responsibilities, we didn't have a school district that was going to do it. So we thought, well, let's comply with public meeting laws, right? So that anybody can participate and that people will be educated. Let's create bylaws for the steering committee who's going to make these decisions. Let's make sure that when we have people who sit around the table, they represent providers. So, we have a Head Start representative, we have a city representative, we have, different types of folks who are actually closest to the ground. And we start to build our local governance system. And the state says, that's fantastic, Orleans. Now we're going to actually codify that into law. And so now you start to see these other parishes step into those same roles. And that's relevant because, and I'm going to ask you to go to the next slide, Maggie. That is, and it's just here for information only. You're going to get copies of these slides, but that's the ecosystem, right? People who are all here in Orleans Parish are trying to figure out how do you coordinate a really, really messy system that's still messy at the state because you got some things that fall under health and some things that fall under, the Department of Education and some things that fall under workforce. Well, now you have a place locally where all of these partners can come together and make decisions that actually have teeth. And that's the important thing, right? We're not just sitting down and developing a strategic plan. We're sitting down, developing a strategic plan, and we have the resources that are able to be deployed in a certain way, right? So we're not going to potentially give seats to organizations that maybe aren't performing on their class scores, right? So you start to see more ownership and more buy-in. And I'll ask you to go to the next slide, Maggie, because it is because of that governance that we had in place for over almost 10 years that we were able to go to our taxpayers and ask them to invest in infants and toddlers with a property tax. And a lot of people, when they tell the story of the New Orleans millage, they think it kind of just happened overnight. And I think what Libby just did as well is show that this has been a long journey. We are essentially in year, almost 12 of this work locally around coordination. And so I'll just give you some quick wins. So we pass a $20 million property tax per year for the next 20 years. So it's essentially about $60 a month per kind of household that they're paying for this. It serves 1,000 children with fully comprehensive wraparound supports, in addition to infrastructure. And I'm going to ask you to go to the final slide for me, Maggie. And that is that in addition to seats, I'm so grateful for partners like Libby and our partners and advocacy groups on the ground. We were very clear it couldn't just focus on seats, right? So in addition to seats, it had to focus on wages for teachers and facilities, both new and improvements, these quality supports around coaching, having medical services for the children, having these strong public accountability systems where we would have to do annual public evaluations that would not just get presented to public officials, but also in our public meetings for that group that we, created. And the big part here and how it really connects to Libby is, and one of the ways we were able to get voters to say yes was that it was a one-to-one match from the state. So while we were working locally on trying to build all this infrastructure and implement some kind of a new model of governance, Libby and her team and other advocates were working at the state level to make sure the incentives were there. And so one of our biggest talking points was 23 million is actually going to be 6 million potentially. And it's been a huge win. And we can talk about, some of the major accomplishments of the program, but if it had not been for this combination, not just of state and local governance, but also organizations and advocates that focus at the state level and the local level, the story just really wouldn't be possible.
I love this. And, I love we at CELFE talk a lot about governance and finance have to be kind of two sides of the same coin, right? That if we want to really better serve children and families, make sure that every kid who needs X gets X and not gets Y, you really have to think about the governance. And so I love how your governance and your financing strategies weren't necessarily named to be governance and finance strategies, and that at the end of the day, that's exactly what you guys have done. So I love that. I love the focus on comprehensive services, the accountability and transparency. I think resonates regardless of red or blue, what state you're in, right? We want transparency. We want to make sure that we're maximizing the dollars that are available to us, and that they reach the intended purpose or population. So I think all of that is super great. And one of the things that we, as part of our vision at CELFE, is we talk about early childhood to be seen as a public good, just like we do K through 12. And so I love the public will part of what you've done. So super exciting. So I want to go beyond city seats a little bit and really go back to this kind of local and state, and really, Libby, from your perspective, talking a little bit about the incentivizing local investment and how that plays out in other parishes.
Sure. And so I also want to just piggyback on some things that Jen said. And I would really hold up Noween and their governance structure as a gold standard. Because what often happens in school districts, and no fault of their own, is they're supposed to have an early childhood governance structure, but because you're in a school district, what your governance structure actually looks like is that board, that education board in that locality. And so, Jen and their teams really practice not just the words, but what they do, with really practicing public meeting laws, making sure there's transparency, ensuring that you have providers at the table to help make decisions is increasingly important. And at the same time, because they're administering the City Seats program, drawing down the state match funds, the way that they're able to do administrative advocacy is increasingly important as we have questions about, like, what does it look like for a one-to-one match? It can't be federal flow-through dollars. It has to be local dollars. And what do those local dollars look like? And then also, as we think about access and quality, and they have to be joined together, if we're raising dollars locally, we have to think about ensuring that that little person is going to be able to have access to quality early childhood education through age 4. And it's not just a hit it and quit it 1 year type of thing. And that's really, really important. And what we've seen in other parishes, there are now 14 parishes, so 14 other local early childhood communities that are saying, we want skin in the game. The cool thing that we've seen is that they're all doing it a little bit differently. So you've got the parish right next to Orleans, which is Jefferson Parish, that their parish government, they find a certain amount of money annually within their council districts, within their parish government. Versus if you go to Central Louisiana and Rapides Parish, they have a very generous foundation there that is able to help them draw down local match, because you can have philanthropy dollars to count as local dollars. The same thing in Shreveport, where they've raised a significant, almost $3 million of philanthropy for matching funds. The constant conversation we have with locals is, yes, philanthropy has a place to help ignite and think about how do we draw down these local dollars, but what does sustainable revenue look like? Because one of the pieces for Ready Start networks, and they have these 4 pillars, and one of the pillars is fundraising. And Ceci, you probably heard me say this. That word actually irritates me, because we're not talking about cake sales. We're actually talking about revenue generation that's sustainable. And so having those conversations with locals becomes increasingly important, of how do you have sustainable funding within the match fund, but at your local level. What does that look like? And those really force some interesting conversations at the local level with parish city government, with local school districts. If you're going after, let's say, a property tax, aka millage in Louisiana for K-12, why not tack on early childhood in that, if you're really talking about a continuum of education? And what does that mean? And so those conversations are always dynamic. If I think about like the trade-offs, is that we've galvanized across the state, many, now 14 parishes, to say, hey, look, we want to put skin in the game for the early childhood education fund. We're just not generating enough revenue within the year that we're going to be able to sustain that. And the other piece is we have a state that's very, very rural, and we have localities that are not able to generate their own revenue to be able to access the fund. And so in the dream of dreams then is, what does it look like that we could have enough revenue going into the early childhood education fund that there would then be excess, so that we could equitably distribute through a formulary for parishes that are not able to generate their own revenue, but not punish locals like Orleans and others that are able to generate revenue. It's really tricky balance of how we think about that.
Yeah. Jen, how about from where you sit?
Yeah, I think there's a couple of things. One, what we have learned, and one of the things that was really important for us was building confidence in providers and in the system itself, right? So when we talk about the City Seats program, we started the evaluation that was an independent evaluation from year one. Right. And so by the time it came down to like passing a property tax or asking for more money, we had 8+ years of program evaluations that showed, hey, this is what's working. Hey, this is what they improved the next year. This is where things are going. When the millage was passed, we actually really souped up our evaluation. So now we work with Child Trends. So Child Trends is doing a very extensive evaluation of the program that doesn't just look at seats or where those seats are, or it doesn't just look at program fidelity, but really looks at the investments that we have been making and whether or not they're moving the needle. So that was one thing that I think is huge. The other big thing that I think was huge was before we went to voters, because we had all of this governance in place, we developed a cooperative endeavor agreement, which is a contract with the city of New Orleans that the council passed alongside with the resolution to put it on the ballot. And what that CEA did was told every voter where that money was going, what entities would be administering it, what does the what does the payment schedule look like, how would accountability be enforced, who would need to present where and when, here's what happened if the funds were misused. And as a result of that, it wasn't just that voters were kind of saying, hey, we like kids and we really want to vote, in favor of children.
Right.
It was, we care about kids, and you know what? We're going to place our faith in, a public-private partnership because there is a already finished contract that hasn't been signed, right? But says how things are going to be monitored, says how things are going to be executed, and says how things are going to be evaluated. And that, I think, is also just such a huge part of the story around governance, because in this case, it's even micro governance, right? It means that you're actually outsourcing your local kind of authority over that, which in our case would be the mayor or the city council, and you're actually even subcontracting it to this outside other agency through a public-private partnership.
Yeah. So Jen, from where you sit, so Libby talked a little bit about that kind of issue of equity, right? It's a trade-off in terms of the rurality of the state and the resources that go along with that. In the parish or in the city of New Orleans, what are the trade-offs that you're seeing from where you sit?
Yeah.
Kind of a little bit more up close.
Yeah. So there's a couple of things that are, I would say they're hard, right? So we care about quality, which also means we have to pay for quality. When you pay for quality, you have fewer seats or fewer resources to support other things. And so for us, that means 70+% of our budget immediately goes to contracted seats or tuition for children. It also means that if providers want for us to increase our rates because inflation is happening or other things are, are eroding the value of that seat, it means that we have to pull from somewhere else, or we have to grow the pie in a much more dramatic fashion, right? Because even just shifting $1,000 per kid can eat up significant amount of money within the budget. The second thing that I struggle with equity is that it is abundantly clear that our providers who are participating in our City Seats program, either through our funds or the state matching funds, are stronger. They are stronger in terms of their performance. They have more stable families. And, for example, when we do our evaluation, we just learned that 94% of the families who are participating in our program said that this program helps them maintain or seek employment. It told us that 80% of them attribute it to their ability to stay in their homes with housing. 90% want to recommend it to a friend, but know that there's not seats available, right? And so I think as a result, there are still limited resources. We're so, grateful that we've got $40 million a year, but I've got 6,000 kids who are eligible who can't participate. And so when I think about equity, every day I'm going into thinking about the families that can't be served and the dollars that I don't have to give it to more childcare centers, because
Yeah.
I do not want to inadvertently create an additional system of haves and have-nots by the nature of, because the performers, the childcare providers who are participating, they're getting stronger and stronger, right? And so as a result, and I would say that we have tried very hard to do this, that tension, right, with the state can come into play because we will go forth with the state and say, you are no longer, they'll say, you know what, these kids, their parents make more money. So they're no longer eligible for the state matching fund seats. And we'll say, absolutely not. That means the program's working, right? And so we don't want to punish the families when their incomes go up. Or you might have, a different situation related to, um, no, the dollars have to be used only on your participating centers. And we'll say absolutely not, because if that's the case, then we'll never build the capacity of those who aren't participating in the system, which means we are creating bifurcation, right? So it's all about that administrative advocacy, especially being the first program who got to cut our teeth on this.
Right.
Good policy on paper is one thing. Trying to implement it in a very dynamic system where families and providers' needs are changing constantly is kind of our unique value add of being able to translate that.
It has been ground shaking because of that, and we as an organization, I know Jen as an organization too, we always have this reciprocal relationship with our providers, because to Jen's point, we could have the best policy idea, but what does it look like in implementation? And so when we think about the Early Childhood Education Fund, it's a really good idea, but what are the mechanics of it that we need to help evolve? And so having, Agenda for Children with Noeen help us think through that process, as well as other parishes, because there's just some rulemaking around this that sometimes can be problematic. And so we have to be able to listen to the locals to understand, when it goes to our Board of Elementary and Secondary Education, where are the hangups between Jen and that point? And how do we have those conversations? How do we advocate from multiple levels, and really surround sound about what needs to be changed and how, so that we can make the system responsive to the needs of the providers and the local networks? Because ultimately, if this isn't the best thing for little people and our providers, then what are we doing? And so we're always trying to ensure that we're doing the very best by our little ones and our providers to support an ecosystem that is fragile on the very best day.
Yep. So I want to dig into city seats is for 0 to 3, right? Birth to 3. Correct me if I'm wrong. I think I'm right. So I'm curious in terms of really thinking about access. We know we have resources that are limited, but so many states are really, investing in state-funded pre-K, and they're really thinking about preschoolers. And you guys early on really elevated infants and toddlers. And our last webinar in this series really dug into data. You guys, again, were a forerunner in terms of really using data. Can you just talk for a minute about what brought City Seats to be an infant toddler focus initiative, as opposed to a birth to 5 or really digging down in preschool?
Yeah.
I'm going
So
off
I think
script
that's
here.
part of this amazing thing, right? Is that we, as part of our lead agency responsibilities, we have to do something called child count, which means we had to conduct census of every single childcare center, which showed how many kids were being served. And it didn't just mean publicly funded, right? So we would ask the question, how many infants and toddlers are you serving? Get it by age, by year, twice a year, right? So we could track over time how many kids were being served. We are also the Kids Count grantee. For Louisiana, we also track census data really closely. So we can also then say, well, if these kids are being served, then these kids are probably not being served, or they're in a kind of formal setting, right? And so I think that for us, we knew the data was so clear. At one point, we were about 110% of serving 4-year-olds in Orleans Parish. And we could see the major gaps, right, in 0, 1, and 2-year-old programming. And we made a conscious decision to serve infants and toddlers for that reason. I think the thing that's been amazing is that since the millage has passed and we have literally, expanded access for infants and toddlers by an enormous factor, we are now the largest publicly funded early care and education program in the country per capita, and the only one focused on infants and toddlers. So that's a big distinction now, because when we talk about expanded access, so many people talk threes or fours, but now we actually can prove and have the data that we are the largest.
And when we drafted the initial legislation for the fund back in 2017, we were very specific about it being for birth to 3-year-olds, because we serve as a state over 90% of our 4-year-olds that are at risk. So I often say 4-year-olds are not what keep me up at night. They're just not. But this birth to 3-year-old population is. And so to have, as we develop the statute for the fund, to be very specific in that, so that we're not overdoing with the group that is doing relatively well with the 4-year-olds. And in 2019 is when we augmented the ECE fund to have the dollar for dollar match. So it went from 2 to 1 to 1 to 1. And that made a meaningful difference too for locals to be able to say, look, we want to invest more as well. All at the same time, we helped support a PDG grant that went in with our Department of Education that said, you know what, we want to serve more 3-year-olds, but we don't want to serve more 3-year-olds at the risk of not serving more infants and toddlers. So with that preschool development grant that happened in 2019, it was, let's pilot what trying to get to a 3-year-old program would look like, but not at the cost of infants and toddlers.
Right.
And so along the way, for us as, policy types of people and advocacy people, is to say, like, this is the population we need to focus on. And so the fund helped us do that. And then that helped us think through what are the other policy shifts at the state level that we need to ensure happen. And that's how we got to that first investment of state dollars in 2019 into our child care assistance program.
Yeah, awesome. So in addition to, you've already told us, you guys got to go find more sustainable revenue, because your fund is not enough to meet the need. What else is in the future in terms of really building out what you've established over these many years? What is the next systems change initiative or path?
I will say for us at the state level, and we're working with locals like Jen and others throughout the state, what does a sustainable funding formulary look like for birth through 4-year-olds, even though we serve so many of our 4-year-olds that are at risk? But what does that look like? And not just from like the state level down, but what does it look like from the community level up? Because New Orleans is a prime example of these are the things that we need to focus on. And Jen will add in her part about their wraparound services, which are just awe-inspiring. But for locals to say, like, these are the things that we really need to think about. And it can't be the same as a K-12 funding formulary. It just has to look different because the mechanisms are different. So we're working on that right now. And we hope to have in the next 2 months, not a completed funding formula, because that's going to take years to get to, but because we have this bevy of data for parishes to be able to go on our website with another dashboard for them to see what's the delta of revenue that they have to think about generating to serve the majority of their children birth through 3 that are at risk. And they can slide up and down the scale. So really to help them advocate for their needs, and at the same time understand the population in which they need to serve in this birth to 3-year-old population that really is transient at best and so expensive to be able to create access for.
Jen, anything to add there?
Yeah, so a couple of things. One, we have local money, we have some state money. Both are very precarious. Even though we have a property tax, if people don't pay their taxes because things are, enormously expensive right now, that means that kids don't get seats, right? So having the mechanism does not always mean that it is an intent to spend. It does not mean you have the money to spend. So that is like a huge distinguishing thing that I think about, and that keeps me up at night. One of the things that I think we're trying to think about is, Libby mentioned our wraparound supports model. One of the major elements of that wraparound support model is a fully fledged kind of push in medical, a model. So we actually have 7 full-time staff at our local children's hospital who are dedicated exclusively to our sites. and that's what we pay for with our millage funds. We haven't yet figured out how to count and to tap into the Medicaid funding, because if they're eligible for Medicaid or they're eligible for Medicare, they should be able to be, using and billing for those services. But how do we do it in a way that's not punitive to the family because a doctor came in, saw the child, and now that counts as their well visit, right? And so we've been trying to really think about how do we leverage additional resources, especially for some of those services. The other thing that I think about that keeps me up at night is the workforce and the rates and how do we increase. I am so tired of talking about teachers and educators in the form of like hourly wages. These are salaried positions. And until we start really thinking and building financial models that support that, I think it's going to continue to be challenging to recruit people into the field. And then lastly, and this is really appropriate right now, eligibility. So many of our programs at the state and the federal, and now, in our case, the local level, are conditioned on eligibility for, quote, SNAP. And it gives you dual reciprocity for those programs. If programs are not going to be funded or continuing, there's a lot of legislation and a lot of regulation that is currently embedded in our systems that are going to create kind of gaps for kids. If you need SNAP to be eligible for X and SNAP doesn't exist, then we have much bigger issues that we need to figure out because they're going to lose their food and their childcare.
Right. Yeah, no, I mean, I think always, this is always the challenge for effective advocacy is always having to kind of read the moment, right? You got to read the room, and that changes all the time. This is a particularly unique time in terms of like the impact that it has on local and state systems, right? Both from a financing perspective in terms of the dollars are potentially going to be lost, whether it be through Medicaid or other SNAP or other services. But it's also, as you said, and I love how you guys elevate the administrative advocacy as well as the legislative advocacy work that really goes into this as on a day-to-day. Every administrative advocacy is an everyday. You don't wait for them to be in session necessarily, right? It's what you look at every day because we know the devil's in the details. And I love your elevating an attention to mechanisms and implementation, right? It's one of the things that we think a lot about, particularly when you want to think about equitable distribution of dollars. You have to think about what are those mechanisms. Same thing with compensation, right, in the workforce. Like if the only mechanism you have is rates, probably not, Teresa, if she were here, I think she's in the audience, she would say, we're not going to rate our way out of this problem. And so what are the mechanisms that we need to be looking at that's really going to address compensation as a standalone issue that is separate than providing comprehensive quality services for kids. Right. Okay, I'm going to turn us to Tom to see if there are any questions in the chat.
Ceci, there were a number of questions. I'll try to combine some of them. There were some questions about the state funds, what funds the state draws down to make this match available. And Jen, I know you've said some things about that. Could you just quickly talk about that?
Sure. I think that I want to make sure I understand the question, Tom. Could you repeat it?
What funds comprise this matching fund at the state level?
Got it. Libby, I'm going to ask you to kick in because you know them off the top of your head.
I do. So there are 5. One is fantasy sports betting. Then there's sports betting. There's CBD products. Then there's the Pelican license plate, which is our NBA basketball team. And then the other is a casino, one casino in New Orleans that if they make a certain amount of revenue, then a percentage of that goes into the fund. And those are the 5 current revenue sources that go into the Early Childhood Education Fund.
So building on that, the complexity of this is, as Ceci said, this is a wonderful system. And it's still in flux, still building, as you said, Libby, you're trying to address some of the parishes that don't have the local funds and come up with a more comprehensive, fair allocation of state funds. And in building this fund, I'm sure things were bumpy, a little messy. looking back between the two of you, and especially starting with Libby, for states, all the other states that don't have such a system in place, what kind of steps, what are the first steps? How do you get into this?
I think we were really fortunate in the state of Louisiana, in particular in the city of Orleans, parish of Orleans, with their delegation. And so there was conversation with the mayor of Orleans at the time, which was Mitch Landrieu, who had these local dollars that he wanted to spend on creating more access to early childhood. But that came out of the advocacy community that he listened to. And then they were able to start this local investment. And then the fund came about from a local legislator in Orleans and then one in Baton Rouge, where our state capitol happened. So that conversation with our founder at the time, really about what it would look like and how do you create a fund, that was particularly important. When that fund was created, there were no revenue sources going in. So this is my place that I tell you, when you think about the fund sources that I just named that go into the fund, they're all sin taxes. And they are what they are, and we're grateful that we have revenue, but it has to, for us in our state, every time we want to put revenue in that fund, we have to almost create a new funding source because we're not going to be able to tap into something that's already been there. And so I will also say that your state budget is a moral document. And we spend less than 1% on early childhood education in Louisiana, even though we have the fund. And so that contextual information is important. We have done great things. We have so much more to go. And to a question that was in the chat is like, what are the efforts to work for local parishes to build public will and raise funds that could be matched? That's where our early childhood community networks in each parish are having the discussions amongst themselves within their governance bodies, especially within local school districts, of how do we think about generating revenue so that we can tap into the fund.
So you and Jen are both in intermediary organizations, not in government itself. How do you form the relationships with government so you can be active in doing this? This was a theme in our last webinar on the necessary activity from intermediary organizations.
I'll go, and then Jen, I know, has some different things because they receive public dollars. So we as an organization at the Policy Institute for Children, we don't receive any public dollars. But what we've been able to do is through research and data have been able to show if this happens, then this will happen, and really to help game out what a system looks like. And also help support our state agency as a thought partner and help partner on federal grants that go to the state agency to help support the body of work. And that's been wildly helpful. We spend a lot of time running data, doing research that helps tell the story on the importance of early childhood education. And we've been able to galvanize our business community around in our state about why this is important. And so I think, where we have gravitas is we lean into data and research. I say this often, I don't get paid for my feelings at all. And so we really stick to data and research and the narrative of what that is telling us. Jen?
Yeah, I think that for us, we've always kind of been in this role. So this new government thing has always been a little bit challenging for us, right? We started as the state's first advocacy organization, and we're putting people on buses and driving folks up to Baton Rouge and suing the state of Louisiana, right? And so now to feel like we're in this governmental kind of role is challenging. And it's, something we really have to reckon with. I think that for us, we have really honed in, while Libby can focus on the policy aspects and a lot of the data, we have kind of leveraged our role around the local data systems, around resourcing partners, right? So not just through seats, but I mentioned at the beginning, we have a huge grant making fund. We are technically the largest grant maker for early, childhood in our parish. Because we're investing in other types of projects that support early care and education. And so I think that for us, the funding, the data, and then really driving into the classroom level interventions through coaching and supports for those educators, and then thinking about them as, system actors has been our sweet spot.
And I would just jump in, and I think it relates to both of those questions is, from what I heard, and Jen, I remember the first conversation we had with some of your colleagues at Agenda for Children, and to really think about, and you mentioned it in passing, this shared application, right? So thinking about when you don't have the resources, what are the steps towards coordination to ensure that, again, kids all need something different, to make sure that you have all the information, right? Our last webinar was about integrated data, not just siloed data. And so you guys, I think, are really operationalizing an integrated data approach in terms of how you serve kids and to really understand need. And I think that that's really exciting, and is something that, if you have the data system, of course, building data systems take resources, but it isn't necessarily about the compensation to the workforce or about, expanding the number of seats. But if you are maximizing through a data lens and a need lens, who gets what and how that gets coordinated up here, as opposed to leaving it to families to try and figuring out, where do I find what I actually need? To me, those are huge improvements and steps towards a much more integrated delivery system. And I think the story that you guys have told, in many ways, the vision and that work set the stage for the funding to come later, right? And so not letting the lack of resources today limit the vision for what we want for tomorrow. So I'm, kudos to you guys and the work you do. Super exciting, super interesting. I've learned so much by just listening to you guys each time we've met, and today as well. So we're at time. I want to thank you guys so much for joining us, for all the prep that you did to join us today, and most importantly, for the work you do. We have one more in our series. It's on November 19th. The invitation will be going out. As I mentioned, there are some resources, I believe, in the chat today, and everything that we've done today will be sent out to everybody who's registered for this webinar. And we hope everybody joins us on November 19th for the final in the 4-part series, allocation and braiding of funds upstream at the state and community level. We'll hear from New York City and the state of Illinois. And then on December 2nd, for anybody who's going to be at the Build conference in Los Angeles, our executive director, Teresa Hawley, along with Nasha Patel from Watershed Advisors, is going to be digging into this in person, interactive workshop. So if you're at Build, please do look into that and sign up. And we are so appreciative for everybody joining us today. And thank you for the work you do every day. Have a wonderful afternoon. Thank you.